Okay, over here for my bed bath, I have a gown, a fitted sheet, a draw sheet, a pillowcase, a top sheet, and a blanket. And this here is my bath sheet.
Go ahead.
And over here we have 2 basins, some deodorant, soap, and washcloths. And by the bedside over here we have towels for drying.
Okay, move your bed to a working height. Lower the rail closest to you. Place your blanket over your patient. Loosen and remove the top covers without exposing the patient. Your basin and your supplies are on the overbed table. Remove the patient's gown. If an IV is in place, remove the gown from the arm without the IV first. Remove the IV from the pole and slide the IV through the arm of the patient's gown. Rehang the IV bag. Place a second towel over the patient's chest. Fold washcloth around your fingers of your hand to form a mitt. Wash your patient's eyes with plain water. Wash eyes from the inner to outer canthus using a different clean section of your mitt each eye. Ask the patient if he prefers to use soap on his face. Wash, rinse, and dry the forehead, cheeks, nose, neck, and ears. Rinse, dry, and pat. Remove your bath blanket from your patient's arm that is closest to you and place the towel under that arm. Bathe your arm using long, firm strokes from distal to proximal area, or from wrist to upper arm. Rinse and support the arm to wash, rinse, and dry all the way up to the axilla. Pat dry. Apply deodorant if desired. Place a towel over the patient's chest. Fold the bath blanket back to the umbilicus and bathe the chest using long, firm strokes. Pay special attention to wash beneath the breast.
So we would wash the chest while keeping the patient covered, but we're going to show you how to move the breast so that you can get underneath the breasts. So what you'll do is use the back of your hand and go underneath the breast. So I would use the back of my hand and go underneath like that. But we're keeping the patient covered during that.
Rinse and dry well. Wash the patient's hands and nails by folding a bath towel in half and laying it on the bedside beneath the patient's hand. Immerse your patient's hand in water. Allow your hand to soak for 2 to 3 minutes. For nail care, you can clean gently under the fingernails with an orange wood stick. Remove that basin and dry thoroughly. You may use a file shaper to shape the nails straight across. Check your agency policy regarding clipping of nails. Wash the abdomen next. Place a bath towel lengthwise over your chest and abdomen and fold your bath blanket down to just above the pubic region. With a mitted hand, bathe and rinse the abdomen, giving special attention to the umbilicus and the skin folds. Anytime your face cloth has visible soiling, change to a new clean face cloth. Wash your patient's lower extremities. Cover your chest and abdomen with your towel or bath blanket. 2, 3. Put patient's gown back on. The arm without the IV can be put in first. And if there is an IV present, carefully place the IV through the arm of the gown and hang the IV back up if able. And cover your patient back up with the bath blanket. The legs should be covered with a bottom blanket. Expose the near leg by folding your blanket toward the midline. Place a bath towel underneath the patient's leg. Wash your leg by using long, firm strokes from ankle to knee. And knee to thigh. Do not massage the calf. Rinse. And pat dry thoroughly. Wash the foot next, making sure to bathe between the toes. You can clean and trim the toenails using the same procedure as the fingernails. Rinse and dry thoroughly. Perineal hygiene. Female perineal care. Clean gloves are applied. Assist the patient into the dorsal recumbent position. Place a pad underneath the patient's buttocks. Drape your patient. Wash and pat dry your patient's upper thighs. Rinse and pat dry. With a clean face cloth, wash the labia majora. Use your dominant hand to gently retract the labia from the thigh. Be careful to wash in the skin folds. Always wipe in direction from pubic area to rectum. Repeating on the opposite side. Gently separate the folds of the labia on the side closest to you first and expose the urethral meatus and vaginal orifice. Wipe the labia minora with a clean area of your face cloth, rotating your face cloth or changing to a clean one as needed. Always wipe pubic area to rectum. Last stroke would be over the urethral meatus from pubic to rectum. Wash middle and both sides of the perineum when you are finished. Rinse and dry thoroughly, always from front to back. Cover your patient and lower legs. Remove your soiled gloves. Raise your side rails and obtain fresh water. You've performed hand hygiene, applied clean gloves, clean water, and have a clean face cloth. Assist your patient into the side-lying position. Place a towel lengthwise along the patient's side and keep the patient covered with a blanket. Wash, rinse, and dry the back from neck to buttocks using long, firm strokes. Rinse and pat dry. Clean the buttocks and the anus, always washing from front to back. Rinse. And pat dry thoroughly. Hold on just a second. Perform hand hygiene. Apply clean gloves. Your bed is at an adjustable, comfortable position. Your rail is lowered closest to you. Loosen your bottom sheet on your side. Fan fold the soiled linens. Tuck them under the patient. With your flat sheet, unfold it lengthwise so your bottom edge is even with the edge of the mattress. Your vertical crease is at the center. With a fitted sheet, secure the top and bottom elastic edges over the side of the mattress near you. Fan fold the sheet toward the center. Place your draw sheet on the bed with center fold at center of bed. Position the sheet so it will extend from the patient's back to below the buttocks. Fan fold the top edge and place it next to the patient. If there is any excess, you may tuck it under the mattress. Position the bottom sheet and draw sheet under the soiled sheets. Raise the rail on your side. Unless there are two people working with you, then you may roll the patient over the folded linens. Remove the soiled linen. Fold into a square bundle with the soiled side turned in, away from your clothing. Place the linen in a bag. Okay, help the patient over Assist the patient to the center bed if needed. Place your top sheet over your patient with center crease lengthwise at center of bed. Unfold the sheet head to toe. Have the patient grasp the top sheet and remove the bath blanket. Discard in the linen. Spread the bed sheet evenly over the bed. Tuck in at the foot of the bed. Mitering the corner. Leave the sides untucked and make a toe pleat for your patient. Put a clean pillowcase on.
So I'm going to grab the outside seam. I'm going to fold it over inside out over my arm. I'm going to grab the end of the pillow with the inside of the pillowcase and then just pull it over the pillow.
Put your patient in a low lock position, side rails up, call light in reach, personal items in place. Remove your gloves and wash your hands before you leave your patient's room.